Great. Welcome back, everyone. We are switching gears again, and we're going to talk about the governor's proposed budget for peer support credentialing. And we have with us Patricia Singer, who, I should say Dr. Patricia Singer, who is the Director of Adult Services for Department of Mental Health. And Wilda White is back with us, the founder of Mad Freedom. And so I'm going to turn it over to you both to introduce yourselves and then begin your testimony.
Good morning. I'm Trish Singer. I'm the Director of Adult Services at the Department of Mental Health. I've been there for over 14 years, had other positions prior to that. And yet I am an MD, though I don't currently practice, but I was trained as a psychiatrist at Dartmouth.
And I'm Wilda White. I'm listed on the agenda as the founder of Mad Freedom. However, I'm testifying today actually in my capacity as a management consultant. My firm, Wilda White Consulting, was retained by the Department of Mental Health and the Peer Workforce Development Initiative to help the state develop a statewide peer certification program. And I'm here in that capacity today.
Great.
So a really quick overview, and I don't know how much detail you want, but the Department of Mental Health endorses the value of peer support services in addition to our clinical services, an essential service that serves people who are experiencing challenges with their mental health. And it is it's different than clinical services, and it's a really valuable additional service. And I can go into more detail if that's something that you want. Part of peer, and we currently also, I would say, we already have adult mental health peers working in our system of care. They're both in the designated agencies, and they're working for peer organizations like Another Way here in Montpelier. We feel that certification is something to pursue. It's been talked about in our community, both in the peer world and in the Department of Mental Health for years. We're one of a few states that don't currently have it. And it was a conscious decision. We felt that earlier editions of peer certifications were really constricting in some ways in terms of how peers could be used and where they could serve. But we feel it's time to actually look at and put in a process that supports peers, that offers training and supervision for peers, that helps demonstrate their competency and their value in different parts of our system of care.
Patricia, could you stop for just a minute? We have quite a few new members here, and just describe what a peer role is.
Yeah, so this is not exactly the right way, but let's say you're a first-time parent and you get expert advice from your pediatrician or your OB/GYN or a nurse or books. But what most of us feel is incredibly additional valuable resource is talking to other people who have been a first-time parent, who can listen to us, who can hear our concerns, who can share their experience. And I would say that's a rough metaphor or comparison of why peer support is so good. Is a non-judgmental support service where people really listen to you in a non-judgmental way, where they might offer some examples what helped them in their mental health recovery from their experience. The reason why training is important is because you really want to have an open, non-judgmental attitude. So you're not someone who sort of solves problems for you. You're not someone who you're really someone to listen and to offer support and to help you make the best decision for yourself. So another example might be, breast cancer. A lot of people have support groups where they talk to other survivors to talk about, so how did you really get through it? So we find, and we have found, and there's literature that shows that having a peer support person who has had similar kinds of experiences, who can really just have the time to sit down and listen and to offer share their experiences and really just listen so that people can come up with their own answers in a space where they feel valued and not judged. And so that's a very sort of basic idea, but I try to explain it in a way that if you know nothing about mental health, that you can sort of understand the value of that position. And we hear over and over again, it's like, oh, that was the person that helped me figure out how to navigate the hospital, how to navigate our community mental health center, how to figure out how to deal with my family members or my neighbors. And so it's just an incredibly valuable resource. Wilda might very well give you a better definition.
I can give you an example.
Great.
So I had my first kind of foray into the mental health system in my late 50s. And I I moved to Vermont, I heard about peer support, but I was extremely skeptical of it. I didn't even like the word peer. But almost right after I got invited here, moved back to Vermont, I was invited to dinner at a person's house who actually founded one of the foundational trainings for peer support, intentional peer support. And they were getting to know me, and I was around the table with all people who had lived experience in the mental health system or trauma or mental health challenges. And in the course of discussion, I was telling them how troubled I had been over the last 3 years after my doctor had inserted a diagnosis in my medical record in secret, diagnosing me with personality disorder, schizoid personality, narcissistic personality disorder. And I had gone to therapist after therapist after therapist to understand how this had happened. And they were just saying, oh, well, this is too big for the mind to hold. Don't worry about it. Focus on this and that. But I shared this story with people around the table who had lived experience in mental health challenges. And one said, when you diagnose with a personality disorder, what it means is that you really pissed off a psychiatrist.
Exactly what
and I was cured in the moment. I was cured in the moment because it made complete sense. This diagnosis came after I had sued the doctor for failing to, for causing it and failing to treat this problem. And I literally was just unleashed from this. So the takeaway here is that I had sought help from the traditional mental health system for this problem that was gripping me. I didn't understand why this thing had happened. They couldn't help me. But it was the people around the table who had also had experience in the mental health system, who themselves had also been diagnosed with a personality disorder at one point in their journey, who were just able to give me that lived experience, validate my experience, and did it so in a very matter-of-fact way. So I think that is the essence of peer support, is where you're able to offer something that you cannot actually get in the mental health system. And you get it in a context of non-judgmental support and liberation, right? Peer support is all about trying to free yourself from a system that is really rather kind of can be harsh and unkind. So
Great.
I became a believer in peer support in that moment.
Thank you, Rhoda. That's helpful.
So the certification has a number of different benefits, but what I like about it, to start with, is that it says, here are some trainings that we will say, intentional peer support is one that that basically says, how can you be non-judgmental and respectful? How can you just be with a person and listen? So it gives people skills who are well-meaning, and some well-meaning people have those skills, but a lot of people who want to be well-meaning don't really know how best to support someone. So certification provides standardized treatment. It also provides, excuse me, you're right. Thank you.
No treatment.
Treatment is the wrong word. Thank you. Standardized training. It also has expectations around supervision. So how do we support someone who's working in the community or in a community mental health center to do that work in a very clinical setting? So it offers some expectations around supervision. I think it also is a great way to sort of some organizations I think have used peer support workers who they label that in ways that I think are more like being a junior case manager. So it also offers some guidelines around what is the essential job description or job roles that a peer support person is. So it gives a lot of structure, support, and recognition to this valuable workforce. The other thing is that in some settings, it may very well be that we can draw down Medicaid if we have a peer certification process. And without the peer certification process, we can't draw down Medicaid. And you probably know that DEVA is looking at adding that to the state plan, that if we have certification, we would be able to draw down Medicaid and Medicaid provider settings. So those are the reasons why the Department of Mental Health feels that it's important to support peer certification. So when we had some FMAP monies, I oversee a lot of grants to the peer organizations like Another Way and VAMHAR and Vermont Psychiatric Survivors and Alyssum and so forth. We With FMAP, we were able, with using some FMAP dollars, we were able to give additional dollars to the Peer Workforce Development Initiative, which is a grant that we give already to Pathways Vermont. And that grant supports trainings and supervisions and webinars. So that grant already supports intentional peer support training, RAP. Actually, we have a separate grant to Copeland Center to do wellness recovery action planning, or RAP. But we have always talked about what would a peer certification system look like in Vermont? So when we had an opportunity to give them additional monies, we gave them some monies, 30,000, that's not monies, and they then retained or subcontracted with WILDA to actually do a stakeholder process. So WILDA had already written a white paper a few years ago through the Peer Workforce Development Initiative around what are other states doing, what are the essential elements of peer certification. But the next step really was, okay, so looking at that material, what does our community in Vermont say would work best for Vermont? And so let's start actually defining what peer certification would look like in Vermont. And there was a series of stakeholder meetings that was open to anyone. So we had people who are peer support workers, and people who employ them, and then interested Vermonters. And Wilda can explain to you much more. There were six sessions covering 6 different topics. And I just got a draft report of over 200 pages of the results of that. I still need to continue to sort of go through it, but I'm in the executive summary section, and it's very exciting. We built a lot more consensus. There was a lot more consensus than we anticipated through the stakeholders. And I don't know if you want Wilda to sort of talk about that process and what she found now.
So let's hold off on that. I want to come back to that, but I want to understand from what the ask is.
Okay, so the ask is, so these are the numbers I got from Shannon, our business. So what the ask is, $187,500 in general funds. Some of that she anticipates will be matched by Medicaid. So we anticipate that will gross up to $375,000. We're asking for some flexibility because in the first year, we are going to be doing some startup activities that may not be able to be matched with Medicaid dollars. But our best estimate is we'd like the $187,500 of general funds, and with which we think we'll be able to leverage to $375,000. We actually did a breakdown the other day around what that would look like. The bulk of that money would actually go towards training. And we expect that in the first year, once we have RFP'd and we have a training entity identified, that we hope to train up to 60 folks in the first year.
And may I ask, would that be both recovery and mental health, or just?
Now, currently, we're just talking about adult mental health peer support.
Adult mental health.
As you probably know, VAMHAR, and it's like the Vermont Association for Mental Health, I think, in recovery. Addiction recovery, thank you. They have monies from DSU. They also have some monies from DMH, which I know because I oversee that grant. And they currently have a recovery academy for recovery coaches. And I've been talking to their executive director, Will Eberly, about how, and some other folks at DSU, about how we will eventually have at least some overlap between the addiction recovery coaches, which is peer support in the addiction world, and the mental health. There is some overlap, but there are some differences in terms of trying to deal with your urge to use medications may be different than how to deal with voices.
Before we ask questions, I want to finish with the money.
Yes.
And then we have Topper, and then we have Art. So you said about 60 people will be trained.
Yeah, and then the other monies would go for certification process. So about 100,000 would be for the actual. So once you get trained, then there needs to be some kind of process where your competency is determined, and it is determined that, in fact, yes, you have the requisite skills to become a certified peer specialist. And there's different models. A lot of the models involve an internship, sort of like a social worker does. You get all your coursework, but then you have to actually work in the field, and you have a supervisor. So it'll be probably some combination of some kind of competency test plus work experience, and then you'll get certified. So that's a different entity than the training entity. We didn't want the training entity to say, well, of course all our graduates are competent. We actually wanted another entity that actually is responsible for determining the competency, and also the ongoing CEUs or supervisory supports that people need as they continue in this career. So that's it. 100,000 would be to help set that up and to oversee that process. And some of that may include bringing in the existing workforce.
Existing peer support
Yeah.
specialists. Okay. And my memory is not working today.
And then some,
Would everyone that goes through a training have to be certified, or it is the person's choice whether or not they want to be certified?
I think right now the peers work and they don't need to be certified to work in settings. So I think that at least there's going to be at least a period of time where, depending on the work setting, you either have to demonstrate certification or not. More and more the peer programs, even like Another Way that is not a Medicaid provider, so they couldn't draw down Medicaid currently, really are looking for people who have that training. So intentional peer support or hearing voices, alternative to suicide, those kinds of trainings. And we encourage in our grant language that if the peers that are coming to them to do peer support work don't have that training, that they get that training. So training is separate from certification.
Okay.
Yeah, and more directly, you couldn't force somebody who went through the training to sit for a test.
Okay.
But to use those dollars most effectively, you would want to do everything you could to ensure that people who do complete the training do actually become certified.
All right.
Yeah.
So I'm going to say we'll take a couple questions, but if they're going to be covered by what Wilder is going to talk about, then I'm going to say we'll switch to Wilder. But let's start. Topic.
Training a peer. Mm-hmm. I'm trying to understand.
What that means?
Now, what
So-
a peer is somebody who has life experience
Yes.
in something.
Yes.
What are we going to train them on?
So that's a really good question, because it's like, well, because sometimes if you go to your best friend, let's say you're trying to build a project or maybe that's not a good example. I'll go back to being a parent. So there's different ways to parent. And so one parent might be a disciplinarian, one parent might say, absolutely never can that child be in my bed at night. Another parent goes, yes, they can be in my bed at night. You know, different people have different ideas. I think a peer has that lived experience, but they may not know how to listen well, to not step in and give advice, to not be judgmental and say the way to do this is X. So the skills are really about how do you listen and listen actively, and how do you give mutual support without telling someone else, well, this is the way to go. So what you really want to do is a lot of folks who have mental health challenges have also lost confidence in their ability to direct their own life. So part of that support is really saying to people, let's listen to what you say, let's see what's important to you, and together I think we can figure out your best course, what works best for you. And so that actually takes training. I went to the trainings. I was really surprised by how much I learned in addition to what I had learned, like just training to be a doc. No one had really said to me, well, Trish, this is how you can listen in a way that people don't feel judged or people don't feel like you're not really paying attention. You know what you want to do and you're just saying yes, yes, yes. So it really takes some skills to be a good peer support person, to really offer that kind of support. Do you have anything to add to that, Wilma?
A little, and so in addition to learning about how to be in a peer support relationship, the training also trains you, like, just because you have lived experience of a mental health condition doesn't mean you have the identical experience as somebody else. And so what we found anecdotally in other states in my research is that if you're a person who's maybe you have depression and then you're in a peer support relationship with somebody who hears voices, the person who's never heard voices can get extremely freaked out. Feel like, oh, this is beyond anything I can do, you need to go be locked up. And so the part of the training is to actually give people some background information about hearing voices and what that means and how you support somebody who hears voices. Or some people have never felt suicidal and they get freaked out if someone talks about suicide as like, oh, this is way over my head, but it's really not. And so there's a piece of training called When the Conversation Turns to Suicide. How you use your lived experience to help them. And so the other piece of it is that there's a huge self-care that they need to learn, because you don't want to, there's vicarious trauma. And you need to learn how to make sure that you're not taking on somebody else's anxiety or angst or fears, because you really want to be able to take care of yourself. So that's also part of training. And the final piece of training is you need to learn about the state's mental health system, because you need to be able to offer resources and help people navigate that system. And so part of the training is for that. If you work for a Medicaid eligible provider, you need to learn about Medicaid rules. So part of the training is that. So I think, those are that's the difference between a non-certified peer support provider and a certified peer support provider. The non-certified peer support provider doesn't have necessarily that broad scope of training, but the certified does. They will have the same training, the same competency, the introduction to the same principles. And the final piece is there's a code of ethics that goes with being certified. And so part of the training is training people into what the code of ethics requires of them.
Is that sufficient?
Yeah, well, it's a lot more than I thought. Peer, I've been a peer counselor twice,
So you sort of know the role, yeah.
and I didn't get any of that stuff. I just talk to people about the situation.
The leading practice is that if you have a really good training up front, you don't lose peers. You have very poor training, people get burned out and they don't stay in the profession. And so, Vermont will be the penultimate state that becomes a peer certification state. But I think because we waited so long and because of the process we used to involve people, we'll have probably one of the most robust programs in the country.
Yeah, I mean, this stakeholder meetings that Wilda will describe was really listening to people who are currently doing the work and saying, what's helped you to be a good peer support person? What additional supports do you need? What do we need to build so that you can do your job well? I really was emphasizing the role. You're not a parent. You're not someone's best friend. You're not, judgmental. But as Wilda said, you also need to know, so how do I fit into the system of care? How do I fit into that team? Let's say a CRT team, how do I fit in there? Or how do I fit on a mobile crisis outreach team? What's my contribution to that work? So, yeah.
So we're going to do a couple other questions. All right, then Leslie, then Brian.
Yeah. I just want to see if this credentialing that you're proposing, just for the Department of Mental Health, in other words, it'll be for your peer counselors.
It will be for adult mental health.
Adult mental health. But in the Department of Mental Health NDAs that work for you, is that? The reason I'm asking, and let me go back to the beginning.
Yeah, go ahead.
Monday, the Rutland Legislative Delegation had a conference and a breakfast with Turning Point, which is a group in Rutland, you may know.
Yeah.
And I asked a question about what training, because they're all peer.
Yes.
That the whole thing is run by peer folks. And I asked them what training they had, and they went through some of the training that they had. And I asked them if they were a DA, and I'm just learning this myself. And they looked at me like I had two heads. They weren't a DA, I guess. And so I'm just trying to get the connection when you say peer support. Is it just for the mental health piece, or will it cover a place like that?
It could, yeah. And so Turning Points are, before they got a lot of federal funding, were really volunteer with a focus on addiction.
Right.
And the recovery coaches are now based out of the Turning Points. The Turning Points are actually their employer. And
I don't want to get too far.
That's fine. I think to understand the difference.
But anybody, if let's say I was running a clinic, a private hospital, and I wanted to have peer support in my hospital, absolutely. I could put out an ad that say, I would like a certified peer
Okay.
support worker to work here. The Department of Mental Health obviously works with the designated agencies and the peer agencies that we fund, but it could be for anyone who wants to offer that support. Wilda?
Yeah, I mean, I think it's important to understand that once you become a certified peer support provider, you can work in a lot of different things. You can work at a peer-run respite, a school, prisons and jails, mobile crisis response teams, street outreach, individual homes, support teams and housing agencies, community mental health agencies, peer-run organizations, outpatient day programs, inpatient psychiatric hospitals, community centers, anywhere where there are people, a peer support provider could work.
Yeah, thank you.
Great, thanks. Leslie?
Very quick question. So your your request is in the budget, in the governor's budget? That's my
understanding.
Okay,
yes.
that's great. And are you imagining going through OPR for the credentials?
Yes.
Okay, I just wanted.
So, and that's actually one of the questions that was addressed through the stakeholder session. There's actually a table, I don't know if Wilda's going to talk about it or not, where initially, so we've already had conversations, OPR's had conversations in these stakeholder meetings. And so absolutely, we're looking at to how do we partner with them? And it may be a stage-wide partnership, but yes, we're absolutely looking at that.
Is the funding base funding or one-time funding request?
I don't know.
Base.
It's base, thank you.
It's base.
Okay.
She said that yesterday.
All right, thank you.
I did not get my prep from Shannon. I haven't, yes.
No
So the
worries.
idea is that obviously you have startup costs and you have ongoing costs. So I think having one-time costs to bring it up and not having those ongoing support funds makes no sense.
Absolutely. Brian?
There's 3 areas I have questions about. You mentioned ethics in the presentation. Like, is there a peer code of ethics that's like able for me to look at somewhere accessible, or is the state going to create one? Or
So every state that has a Medicaid compliant peer support program has adopted their own code of ethics. I've taken a look at all of those code of ethics, and Vermont needs to adopt its own. Because code of ethics is related to what the competencies are for your peer support providers, and we have come up with our own competencies. And so as soon as the Department of Mental Health kind of signs off on what the work that was done in those stakeholder meetings that Trish described, then we're going to convene another work group and finalize the code of ethics that you'll be able to see. A lot of times in the other states, the code of ethics really aren't consistent with peer values. And so we want the one that Vermont adopts consistent with peer values, which is why we're going to adopt our own. But we're all, I don't want you to think there's a lot of work involved in doing that. We're on our way. We already have a draft, but we're waiting. We have to get the state to say, yes, we agree with this direction and go forward.
Thanks. And it's important to me that it stood out to me because in social work we're really big on like our code of ethics, and I'd encourage people to look at that. I don't want to take a lot of time up now, but I like what you're saying about how you want to look at the values on a local level and figure out how Vermont makes its own, because I think that's the spirit of it's like this of lived experience. You're looking at like the experience of people in Vermont and trying to guide how you frame those ethics. And then I have to be honest, being peer support sounds more appealing to me right now than being a clinician. Based on what you're saying, I'm curious, what will be the documentation requirements for peers, and what is the estimated compensation range for this kind of job?
So in the stakeholder meetings that we just held, there was a consensus that for this to be successful, starting hourly wage would have to be about $25 an hour. In terms of the documentation that's required, that is also something that the state can decide. But what the recommendation is that it's collaborative documentation, because that is the only form of documentation that is consistent with peer support values. And so I want to take this out of the weeds and bring it up so we all understand. Usually when we go to the doctor, or go to any kind of medical provider, a healthcare provider, I'll say, you'll have the visit, and when you leave, they write a note about it. It's very one-sided. And if you've ever read those notes, they're often wrong. Well, that's really inconsistent with peer support values because this is a reciprocal relationship. It's a mutual relationship without hierarchy. And so in order to be consistent with peer support values, we've proposed collaborative documentation. And it doesn't have to be at every visit. It can be periodic, as like weekly or monthly. Both people sit down, both people in that relationship sit down and document what transpired in that relationship. So that's the proposal. We're waiting for the help to sign off on that.
An example of that, like today, our session, what did we focus on? What kind of progress did we make? What are the next steps? So that might be an example of having a note that both the service support person and the person who's there to get help would collaborate on. This is what we worked on, and this is how it went, and this is where we're going next. So that might be an example of collaborative note taking. The other point to you is saying that peer support looks in some ways more attractive than clinical work. I have to say some of our agencies are really working on how to increase your value as a clinician or a case manager by using your lived experience. So there's some organizations that really value, let's say, bringing lived experience to your work as a case manager or bringing lived experience to your work as a clinician. And so that's off topic, but I will say there's a lot of interest in, so not sort of saying like, I'm a clinician and I'm a blank person and you don't know anything about me. I think, for instance, again, I'll go back to being a pediatrician. I think a lot of people feel more comfortable when the pediatrician will talk about their kids and their experiences and not pretend that they're not a parent. And so, again, I think we want to figure out ways in which everyone that works with folks who have mental health challenges can maybe bring some of that more humanistic point of view to their work.
Well, just like a response to that, which is that's really hopeful for me to hear. Like as a private clinician, I'm collaborative. So like I use the note, like we talk about halfway through, I say, let me make sure I'm getting this right. I read exactly what I wrote. They correct me. And then I'm like, now where are we going? And then we get to the end of the session. I read it again. We make a plan and they know exactly what's being written. And that's uncommon. And
Yes.
Most people are shocked that I do that because they've never experienced that. And when I tell them what actually goes on, it's people are like, oh God, I'm afraid to see what other people have written about me. And I'm like, me too, because this experience is what happens to people. So it's so hopeful because I actually think that what you're doing with peer support can actually transform everything in the system eventually to be better, it really could break down some of the like power dynamics that reinforce people's like suffering. So it's just hopeful. And I feel like it's been a long road to get here because like there was peer support. We've been trying to do peer support stuff for years and it's like obstacle. So I just wanted to say that it's really hopeful to hear the work that you're doing. So thank you. There wasn't really a question at the end as much as like, it's a thanks and like, I feel validated by hearing what you're doing. So
Thank you.
So I'm going to ask Wilda, because I know you had a piece of this and I'm watching time. We have a couple questions. Are you fine with the questions continuing or do you want to?
Answer what's on
Okay.
people's minds and I can fill in information,
Perfect.
as we go.
Okay, Daisy and then Maury and then Topper.
Brian's comment of thanks was a nice segue. I just also wanted to say thank you. I'm aware of how long it's taken for Vermont to get on board with this, that we're one of the last few states, if not the last state, to certify peers. I'm also aware of sort of the conflict of, I don't know if it's culture, but the fact that getting certified, I think Topper kind of spoke to it, is sort of a conflict because we have this lived experience and we bring that to the table and that in itself certifies by experience and expertise. But thank you for your persistence, both of you, at getting us here and we're going to be maybe the last, but we'll also maybe be the best.
We're the penultimate.
I'm curious, because of that, I am really eager to get there. So I wonder, does this investment, it's not actually going to be salaries for workers, right? This is just to get us the final stages of the planning with OPR, stand up all of the operations and procedures and get all that solidified. And will any of this funding go toward already developed tools and trainings like WHAM, Whole Health Action Management?
No, that's along the way. I mean, once you stand up a training entity, right? They can create curriculum to do anything. But the initial funding that's in this governor's bill is for the very basics of a certification program. And the very basics include 3 steps. There's screening people, there's training people, and there's certifying people. And so the first step is, are you eligible to even take the training? And then delivering the training. And then after that, saying, here's the test. Did you pass it? Have you signed the code of ethics? Do you have the requisite work experience? Here's your certification. Here are your continuing education requirements. And this is your recertification requirement. That's all this money is going to do for 1 year. And this money will come year after year because we still need to train people every year. We still need to offer continuing education every year. We still need to expand it to what you just referred to, Representative Rebecca. Is that how you say it last name?
Perfect.
Okay. And I'm hopeful that we'll create a career ladder so that you come in as a peer support provider, but then you can also get a supervisor credential. You can also get a forensic credential. You could get a geriatric credential. And so it helps with, the people with who have a psychiatric history have the highest rates of disproportionate unemployment. And so this becomes an avenue to start addressing that underemployment, unemployment, and giving it a career ladder. But that's a ways off. I'm hopeful that we can do the supervisor certification soon. But did I address all your questions?
Perfect, thank you.
So can I just have a follow-up? So that was great, very helpful. But I want to be clear, this money will be used to get peers certified.
Yes.
To build that,
Potentially up to 60.
to build that infrastructure. So we need to, determine what the application so this is Wilda's report, 267 pages.
That's she's misrepresenting my report.
This is your report.
The appendix is the most is most of those pages. And it includes transcripts of all 6 hearings.
That's true. That is true. However, what Wilda has laid out is, okay, here, as she said, how do you determine who's eligible? How do you train them? How do you certify them?
But it's not just figuring that out. It is actually at the end of a year, people will be trained.
So we will,
certified.
So what we're going to build this year, or at least a portion of this year, is build that infrastructure so that we have the application process, so that we have the training institute, so that when people finish their training, they can go through the process of getting certified. So the idea is to build that so that we start producing certified peer specialists, hopefully within the year.
Okay, thank you. I forgot who was next, Mari, and then Pepper.
Just a second, Brian, thank you. As a healthcare provider, I'm acutely aware all the time of how much people give up when they walk through the door and become change from a person into a patient. And in the inpatient setting involves putting a flimsy gown on with everything exposed to many of my patients, especially elders, still believing that the doctor is the boss or I'm the boss. And when they say things like that, I'll bring it right back around to them and say, actually, you're the boss. I'm here to work with you and help you. But it's I'm just so grateful for the collaborative documentation. It was a big shift when federal law required that documentation be and medical records be immediately available to patients. And I think many struggled with that, but I think it was a good thing. Anyway, it's a long-winded way of saying thank you. It's a big ship to turn around, and I think this will help.
Pepper?
Yeah, thanks for coming in. I'm struggling to try to figure out And it's because of my own personal experience of being a peer counselor, and never having any of this training that you're talking about. It all sounds good. But I thought a peer counselor was somebody who had a life experience in something like fear of dying or suicide feelings, that kind of stuff. And I was able to communicate with those people because I'd been through it. And it was nothing about how you get through the system and all that stuff. I'm trying to get this person in place
Right.
where they're not fearing dying or like the alcoholism thing, they're not drinking anymore. And so I'm
Very different.
confused on,
This is nothing like your experience. What you're describing,
I can tell.
what you're describing, like you're even using the word counselor, that is an inappropriate word to use for what we're just talking about. These are peer support providers. We're not trying to help anybody get through anything. We're trying to help, we're journeying with somebody. We're walking with them as they figure out what they want to do. And we can do that because of our own lived experience and the specialized training. The specialized training is really necessary because this is in the context of a mental health system. This is a Medicaid compliant peer support provider certification program. And to be Medicaid compliant, it has to be part of a treatment plan. It has to be part of an individual treatment plan, it has to be part of a comprehensive treatment plan. And so it requires something very different from what you did. But I meant to say that when you, Representative Peterson, used the word counselor, this is not counseling. That's the wrong idea.
okay, I can agree with that.
Yeah.
Counseling is the wrong word.
Yeah, it's the wrong idea.
It's living with them through the
Journeying with
process.
them. It's like being with them.
Yeah.
And they're in charge, right? You're not trying to get them through anything. They might they may not even want to get through anything. You're listening to what they want and you're helping them get what they want.
Okay, then why are we training them to get through the system and all that kind of stuff?
Because remember, this is in the context of the system. The people who would be coming to, if they are a Medicaid eligible individual, remember that means they're already in the mental health system. And so the person who is the peer support provider needs to understand about that system. They need to understand what Medicaid requires in order for those peer support provider services to be eligible for reimbursement. And you have to understand, and what's really hard, the reason why Vermonters have resisted the certification program is because peer support is really antithetical to the mental health system, right? It's the opposite. People started peer support because they had been let out of hospitals in the 70s and discovered that they came out to communities with no support. They just got left out. They were just deinstitutionalized and turned out in communities with no support. And so they created this system of peer support to make up for that. It's mutual aid. And it was and the earliest conversations were about how the system had abused them, which they hadn't realized when they were in the system. And so their training is really important because they have to figure out how to adhere to the values of peer support at the same time they're in a mental health system. That is a hard dance without any training.
Okay, I'm okay. I just
can't believe it's ringing.
And I'm going to add.
be about to figure this thing out.
I'm going to add something to what Will just said, because obviously my life experiences are a bit different. I think it's also valuable when you're listening to someone and trying to support someone in mutual support to also be helpful when they say, I want help getting this or that. And I think the more you know how the system of care works in Vermont, the more you know about what the resources are that are available in your communities, the more helpful you can be when a person says, okay, you know what, I've listened, this is what I think I want to do. I want to actually get some housing. And so the more that you understand the resources that are available, like the voucher system, for instance. So Wilda, I think his point is that mental health treatment is embedded, Medicaid treatment is embedded in a system. And so the more you understand how to be effective as a peer support worker within that system and your role within that system, the better you can advocate for yourself and for the folks that you're working with.
I agree with everything you're saying, except that I went through the system. So I have the lived experience. I know how to get through it.
Right. So
Why
I
do I
think-
need to have to be trained?
I think-
well, some people may not have all,
I'm good.
right. So I think
Not everybody has gone through a mental health system who has a mental health
Well,
diagnosis.
I'm talking about a person that's going to be a
right.
peer
And
support.
let me focus on the one key that I think might be getting lost in this, is that as a peer, the hope through this process, through the certification, is that you will be able to draw down Medicaid funding. Right?
That's
That's one of the benefits.
The bottom line.
That's the bottom line. So rather
It
than
wasn't my
just,
bottom line.
right, it wasn't yours, but that is, so
That's
that's,
not the bottom line of many.
it's not the bottom line of many, but it is a factor and why
Yes.
we are looking at this, to ensure that we can do that if people want to. Brian?
Yeah, just like, because I mean, I understand, but I'm always learning. So like, in this discussion, I'm thinking more about the role of the peer support provider in the system. And like the closest analogy, and you can correct me if you think this is off, that I come to listening to this is, it's like someone invites me out to dinner with them. And I go we go to a restaurant together and they're looking at the menu and then they want to choose something off the menu. If they ask me, what do you think about this or that? If I understand what's on the menu already, I can like maybe contribute more. And also knowing what I don't know and saying, I actually don't know what that thing is on the menu. Let's learn what that is together. It's almost like you're a friend out to dinner versus the waiter coming in and saying, what do you want? Or someone selling you something. And I feel like as a clinician, sometimes I'm the waiter, or as like I'm in an emergency room saying, do you want this? Do you want that? And I want to be with the person, but they're trying to get through. It's like you're trying to push through. And there's moments where I feel like as a clinician, I am more of a peer because of the dynamic where I'm just sitting with a person waiting for hours and we're talking and it's more equal. But like, there is something missing when you have nurses doing one thing, you have clinicians doing something. To have someone just be with someone through the experience is very valuable. And so I'm trying to think of how could I explain it to people. It'd be like the peer. So in other words, like knowing what's on the menu, even if you're not the one selling it, is important, if that makes sense. I don't know if that's a weird analogy. And then, and so,
I know what was on the menu.
You know the menu.
but you think,
It's
it's,
6 minutes.
we think, but I think sometimes we assume that we know everything, or we assume. So I think there's something to this training around, I'm guessing there's going to be stuff around understanding the context of understanding your role within this vast hierarchy, understanding what power you have and what power you don't have, understanding your bias, because everybody has that. It's just like, we need to be honest.
Those are many of the peer. You're actually ticking off many of the core competencies of a peer support provider.
And so I'm just thinking of this. I'm not even looking at anything. So, okay, good. So the last, but I do have a question.
Oh, okay.
Yeah, I do have a question. So I'm sitting here listening to you, taking notes, processing all this, because that's how I am. And is it appropriate? I hate that word. Because I really do, because I so many times, that's inappropriate, but is it within the role of peer support to advocate with someone if they ask for that?
Yes, that is another core competence.
Okay, all right.
Advocate and helping people advocate for themselves, advocate for them, and trying to influence the mental health system to become more person-centered, trauma-informed, person-centered and trauma-informed.
Or I'm going to give another example. We currently fund patient reps in hospitals. So that if you're involuntarily hospitalized, it's legislatively mandated that you will have a patient representative who's a peer support worker come and visit and work with you. Vermont Psychiatric Survivors. The idea of that is really to augment, so to be with that person, to hear what's going on, but then to help them, not just advocate for the system, but advocate and augment their voice. So sometimes people's voices get lost or they don't know how to share their opinions. But like a patient rep, will work with someone and then they'll say, so these are your choices. Let me help you share that or advocate for you. So it's absolutely a role that people have as peer support
What
workers.
about mediation? Because the thing I see happening as a crisis clinician, I find myself in this role, even though it may not be my role because it's needed and the patient needs it and I just go with them. I do it. I walk with them. I think that was a good analogy. But like mediation, like when like a psychiatrist has made a firm decision about a person and the person's trying to advocate like for themselves and not being heard, is it appropriate if the client or I don't even like that word in this situation, but the person who is being served by the system asks the peer support for help with that, can they or will they be trained in de-escalation and mediation and
Yes, that is another, I'm going to jump to the end.
Okay, I'm sorry.
That is another peer competency.
Yes.
Learning to use the same training that you have to provide peer support, you use to manage conflict between the person that you're in this relationship with and the system.
That's awesome. Okay.
So Leslie, I'm sorry, I'm gonna have to close it out with a couple asks. So if you have an ask, you could ask offline. But I have to, because I need to ask a couple questions and then we're at time.
Okay, can I just throw out, I'm curious about the budget because you mentioned Medicaid.
So can you let me ask my questions?
Of course.
So
I wasn't getting it, Tina.
So for us to be able, so what we would have to do is obviously go to appropriations and say, yes, we recommend this budget request. So what would be really helpful is to have in writing a bit of what you talked about today. I'm not asking, for full presentation, but, what is the ask, breakdown of the money, timeline, and how many, and again, we're not going to hold you to, we're not going to come back on July 1st and say you didn't do this, but a potential date that all this will start and possibilities of the number of peer support specialists you'll be able to get into the system through this process. All of that would be helpful for us to make our decision and then do the necessary recommendation to appropriations.
Yeah, thank you, Wilda.
Great. And Joe, so unfortunately, our deadline is always yesterday. So we're going to be having committee's discussion on Wednesday, March 1st.
Yeah, we'll get it to you by the end of the week.
Great. That's perfect. Thank you. Okay, there's time.
Oh, thank you. I just want to know, I know that you talked about funding from Medicaid. I'm wondering if there's funding from other sources that we can think about. Will commercials pay? Will other kinds of, that. So that it's not only Medicaid dependent.
Well, in other states where they've had certified programs, private insurers also cover peer support. I don't know if that's what you're asking.
That is what I'm asking.
Yeah,
And then what
yeah.
is the process that we should engage in to work on that?
Well, for the stakeholder meetings, I invited all the insurers in Vermont to these meetings. Unfortunately, none of them showed up, but there's a recommendation in the report to continue to engage both prospective employers and insurers in the process. And so I'm envisioning a training, like webinar for insurers and for employers so they understand how to use peer support workers and insurers understand how to make this a covered risk.
That would be
Or
good.
covered service, sorry.
Go beyond Medicaid.
May we, once the report's done, will you share with us?
Yes.
Okay.
There's a draft and once the client
Yes.
authorizes me to release it.
Someone will release it to us. Great. Thank you. Wonderful. Thank you very much. This is really helpful. And we didn't get a chance to talk about what happened in this committee and in the Senate last year around this. But I will say we've come so far from that end of that session. And I think